So now we will be getting our secondary IV medication ready. We will be getting Zefazolin 1 gram and 50 mLs of fluid. And this will be running for 30 minutes. And Mrs. Davis will be getting this every 8 hours to treat her pneumonia. So we will also look at our 50 ml bag. We want to make sure it's the right medication. So in here, it's supposed to be Zefazolin 1 gram and 50 ml of fluid. And the expiration date is January 1st, 2023. We will also look at this and make sure that there is no floating particles and that the solution is the right color that it needs to be. And there's no floaties or anything in our bag. We will also be checking our our secondary IV tubing for the expiration date. This one is July 31st of 2025. And we will start getting this medication ready to administer to Mrs. Davis. So we will be getting our secondary IV started. We open our IV bag. We look at our tubing. We make sure that our clamp is closed. We grab our IV bag. We uncap it, discard it, uncap, and spike. We also want to invert this one. Squeeze the chamber. So we are priming our secondary line. We will put this over a trash can and we will slowly open our line and feed the medication through the tubing, making sure all the air bubbles are out. And making sure we're not wasting any medication. Now we have this all set, and this will be connected to our primary infusion. So we want to make sure that our secondary IV also has a label. So this is for Mrs. Ellen Davis, her date of birth, Zefazolin 1 gram and 50 mLs of fluid. It's going to be given over 30 minutes and it should be given every 8 hours. The start time, the end, the date, and the initials. So we put that on our bag, and we also want to label our IV tubing as well with date, time, and initials. So that is there as well. Now we have both of our primary and secondary IV medications prepped, and we will proceed to administer to Mrs. Davis. We also want to calculate the drip rate for the Zefazolin and the 50 mLs in 30 minutes. We will be infusing 17 drops a minute. So this is what our primary and secondary line look like. We have our primary line under the secondary line as we want the secondary line to infuse first. We will now proceed to go to our patient and start the infusion. So we will now be administering the IV infusion to Mrs. Davis. This is Mrs. Davis. We will proceed identifying our patient. by asking them their name and date of birth and correlating it with their identification band. She indeed has stated that her name is Ellen Davis and her date of birth is 9/19/1963. This is her IV access. It looks good. There's no signs of infection. Usually before any infusion, we will assess the site. We will flush to make sure that the IV is patent, and we will proceed in connecting our IV medications to our patient. So now we will perform hand hygiene. We will don on gloves. We will take an alcohol prep pad and clean the hub to our IV access for our patient. We will grab our IV and we will connect it. This is our primary line. So we will now open our roller clamp and start infusing the primary IV, which is a 500 ml of normal saline, and we will be counting 21 drops per minute as our drip rate. So we are connecting our secondary IV, which is a Zephysolin 1 gram and 50 ml of fluids. We will connect our secondary line to our primary line. We will get an alcohol prep pad. We will clean the hub. We will make sure that our secondary line clamp is open, and we will control our drip rate through our primary clamp. So we will make sure this is open all the way, and we're controlling the drips. And for this medication, the Zephysolin, the drip rate is 17 drops per minute. So you count 17 drops in 1 minute, and you're controlling it with your primary roller clamp. Once that is all set, it is now infusing into Mrs. Davis. You stay with a patient for a while. Make sure they're tolerating the infusion. You're looking for any signs and symptoms of an allergic reaction or fluid overload. Now we proceed to document our medication administration. The date is today. Time is now. So we have documented our medication, and we will proceed and write a quick nurse's note just stating what medication was administered at what time, how the patient tolerated it, and if there was any adverse effects.